So there's another session right now after our session, so we'll get all the questions you guys can discuss after the entire session. Let's start with the protocol. We will talk about identifying delegated patterns in the nation, wastewater surveillance data for COVID-19. And surprisingly, these are high school students, senior year.
Hello everyone, thank you for coming and staying for the end of the session. I know it's been a long day. So you can see from my presentation, this is going to be about unveiling the hidden information in the National Wastewater Surveillance System data for COVID-19. Now, the question is, what is this hidden information and how do we obtain this information? I'm going to keep it a secret for now, but by the end of the talk, I think your faces will light up. I know this may come as a tall order, but let's see if I can make this happen in the next 10 to 12 minutes. My name is Shunyu Tang. I'm a research assistant working for Professor Spatial at Indiana University of Pennsylvania. So we know that COVID-19 has been a big pandemic. It's taken away a million lives in the United States and over 7 million lives across the world. And back in 2020, when the pandemic was first broke out, things were really out of hand because no one knew who around them was infected. People were dying. So after 3 years have passed, we need a better way to get the total number of infections. We need a better estimate. And currently, people have done testing. And testing has worked out for a moment, but there's a problem with testing because people may be asymptomatic. What that means is people may not want to report their health conditions. They may not feel like they need to report. They don't feel the symptoms. So testing is kind of off. And because it's off, there's a gap between the reported infections and the total infections. And the government, when they receive the reported infections, they cannot allocate medical resources properly, they cannot send out timely alerts properly, so everything goes bad. So we need a better solution, and the better solution is on wastewater-based epidemiology. And you can see there are a lot of benefits to this approach. And the logic behind this is, although not everyone reports health conditions, everyone defecates. So therefore, from the virus concentration in the wastewater, we can translate that into COVID-19 infections. And that includes both reported and unreported infections. This is really cool. And the data we used came from CDC, it's National Wastewater Surveillance Data. And CDC has their own visualization of this data, and you can see this in this map. And I think this map has some limited information because we only see the virus levels and how they change throughout the country over time. We don't get the reported infections and the unreported infections. So there's a lot to do here. And in order to translate SARS-CoV-2 concentrations into COVID-19 infections, we need to deal with uncertainties. And uncertainties came from a lot of sources. And most importantly is the virus shedding uncertainties. And virus shedding uncertainty, we can see in pieces alone, it ranges from 10 to the 2 to 10 to the 11 genome copies per million. That's 9 orders of magnitude. So we need to deal with the uncertainties. And we're not the only group dealing with these uncertainties, other groups are too. And the difference between our research and their research is other groups are doing this kind of research in a limited area where there's only a couple of sewer sheds, whereas we're doing it at the national level. So as a result, for their research, it's unclear whether their results can be extrapolated to other scenarios because they're doing it in a small area. We hypothesized that although each individual may shed viruses that may vary significantly, if you look at the national picture, that uncertainty can get reduced. And we make two assumptions. The first assumption is we assume virus shedding does not depend on geographical location. So what that means is if I'm in New York and I shed virus, and then also in California and I shed virus, those two amounts should be the same. And the second assumption is we assume the same variant of the virus is prevalent across the nation at any time. So with that said, we made our own custom machine learning model, and we call it a PNN model, a phenomenological neural network. And this model is composed of two other kinds of models. So you may have heard of a conventional machine learning model. They're often heavyweight, they're clumsy, they don't generalize well due to overfitting, and they're uninterpretable because they're a black box. So all of these cons. And also there's a phenomenological model. And this kind of model is interpretable and simple. So we combine both of these models and we made our custom model. To make this model, we use Python and several libraries, and the code is available in my GitHub if you want to look at it. And the map here shows where our data was scattered in the United States. It was 47 states, and including Hawaii and Alaska. So it's pretty well scattered. Now here are two data sources. The first data came from CDC. On the left, they give us the virus concentrations in the wastewater. On the right is Biolog, and they give us the reported cases. And because the data did not line up, we compiled it into a third data set. That includes all the important information. Now with our data, how do we actually compute the unreported cases? So here's the algorithm. It's quite simple. So we take L total divided by S total, and that gets us the total number of infections. And then we subtract the reported infections, and then we get the silent infections, the unreported infections. So L total, what that means is it's the total amount of virus received at a wastewater treatment plant. And S total is the total amount of virus shed by a single infected individual. So when we divide, we get a total number of infections. Now, to calculate S total, we need to understand the virus shedding dynamics. And that's in the above two equations. The first one is the virus shedding growth, the second one is the decay. And if you integrate the equations, you get the total amount of virus shed by one infected individual. Okay? And visually, you can see from on the left graph, you can see that the virus shedding on an hourly basis, it peaks within 8 hours, okay, and then decays afterwards. Now because our data is only by day, and the virus shedding peaks within 8 hours, we can simplify this model into a single decay model on the right. And because we're using the decay model, we have two parameters, SM, the max shedding rate, and RD, the decay rate. And with these two parameters, we can model any virus shedding curve. Now that's just for one person. If you want to see this on a population, for a group of infected population, we can look at a third graph down here. So suppose there was a hypothetical peak of infections, black line, and we stack the shedding rates in response to the peak. And we get the red line, which is the stacked shedding rate. Now see that the red line and the black line do not line up. There's a lag between them. So as a result of the lag, we need a third parameter. The third parameter is called TM, the lagging time. Okay? Now, with these three parameters, we can actually calculate the unreported cases. So we can look at an example here. So given SM is 4, RD is 0.5, and TL is 0, calculate the viral load for each day. So to do this calculation, we multiply two vectors, vector of cases by vector of virus decay, and we get a square matrix, and we take the inverse diagonals and sum them up, and then we get the output of the viral load. Now, in a real practice, this will be the reverse process, because we're actually given the viral load from our CDC data, and we're trying to get to those three parameters, SM, RD, and TL. Okay? So to do that, we need to look at our phenomenological neural network, which is our new custom model that we made. So it takes in days and cases as inputs. It interacts with the three randomly initialized parameters, SM, RD, TL, and does forepass, calculates the inverse diagonals, and then calculates the simulated viral load compared to the actual viral load, computes the mean squared error of loss, backpropagates to minimize the loss. And on the right here is the code example showing how I optimize just the SM parameter. So you see that I initialize SM to a value of 10, it can be any random number, and I set the target to 41017, which is the target. And we're trying to see if we can get the SM to converge to 4 based on the target. So after 200 epochs, learning rate of 0.001, you can see in the output there, the loss converged to approximately 0, and the output and the SM converged to approximately 4, which is what we saw in the previous slide. So everything worked out. However, not every data will cause the algorithm to converge. We see that here, the data was taken before the treatment plant, about 50% were not caused it to converge. And likewise, if it was taken at the treatment plant, another 29% would cause it not to converge. And the reason is due to poor data quality. And here are two examples of one that converged and one that did not converge. So clearly, the one on the left converged because you can see there's a red line there that was the simulated viral load, and it captures the rising and downward trends of the actual viral load. On the right there, we don't even see a red line because the algorithm is not converged. And the reason for that is due to the zigzag lines on the right there. And I like to stress out the importance of our custom model, the PNN model. If we use a conventional neural network, conventional machine learning model, it will just memorize the data on the web. It will memorize the zigzag lines. However, if we're using our model, it will not even model it. It will throw out an error. So then we can discard the bad data. And after we have gotten the converged cases, we can plot them out into 9 different geodivisions. And there are 2 important takeaways from here. First, remember I said earlier that the virus shedding can vary up to 9 orders of magnitude, but now we see that it's been reduced to 2 orders of magnitude. So that has been a big improvement. And second, I said earlier that the virus shedding does not depend on geographical location. However, we can see that from the different geographical locations, we see there's still some variances. And the reason for that is due to the unreported cases. So therefore, when we try to take a reference SM value to calculate the unreported cases, we want to choose one from one with the least amount of variance. In this case, that would be East South Central over here. Now, after we have chosen the SM, there's still some other factors that will influence our results. For example, low temperature, high population, and low competitive flow rate will give us more deterministic results. And over here are some results, our calculated ratios. So on the right there, there's a ratio of 8.7 in Dauphin County, Pennsylvania. So what does this number mean? So this number means that for every reported case in Dauphin County, there's approximately 9 people that are unreported in Dauphin County. And nationally, the median is 5.7. So to conclude, the most important takeaway is we trained a PNN model. Okay? And this PNN model can translate SARS-CoV concentrations in wastewater into COVID-19 infections. And that includes both reported and unreported infections. And that is the hidden information in the data. And this research is helpful because it can guide public health actions in response to a resurgence of COVID-19 or breakout of a new virus in the future. I'd like to acknowledge the funding from the College of Natural Sciences and Mathematics at IUP and my research advisor, himself. Thank you so much.
Our speakers one more time. If you have questions, so we can discuss after the session. Thank you for your attendance.